Hi, and welcome to A World Without Malaria. My name's Chris. In this chapter, titled Malaria and Vital Signs, we'll discuss what the vital signs of the human body are. We'll look at how to measure these vital signs, and we'll also process what information might be discerned from the results. For this, you need a thermometer and a watch or a clock with a second hand. Now, as normal, it'll help you if you open the manual accompanying this series and make reference to it as we progress through this video. We'll be in Chapter 9. Enjoy.
Hi, my name is Ellen. It's good to be with you. Vital signs are the indicators of the body that give information regarding the physical health of a person. They give clues if someone is healthy or unhealthy, and they indicate what part of the body might be diseased or in stress. Okay, now there are 4 primary vital signs. The first is our body's temperature. Second is the heart rate, or we can also call this our pulse. The third is our breathing rate. And the 4th vital sign that we can measure is our blood pressure. All the vital signs of a person, except temperature, vary according to age, weight, gender, and overall health. When you know what the normal body temperature, heart rate, breathing rate, and blood pressure of a person should be, then you also know when it's not normal. You can conclude that something in the body is not functioning well and begin to determine how you might support the healing process. Body temperature can be measured with a thermometer. The temperature is measured in Fahrenheit or in Celsius. The normal human body temperature is between 98.6 and 99.5 Fahrenheit, or if you measure in Celsius, it is between 37 to 37.5 degrees. There are slight variations in temperature readings depending on the place you measure from, but the numbers we are using in this presentation are sufficient for most situations. If you measure someone's temperature and it's higher than normal, let's say between 99.5 to 100.5 Fahrenheit, which as you can see on the picture is 37.6 to 38 Celsius, you know that they have a slight temperature. If they have a temperature, this typically means that their body is fighting an infection or inflammation. When the temperature is even higher, it means that the infection or inflammation is more serious and the body has to fight harder. In the manual, you can see the overview of all these temperatures. Keeping the manual nearby as a resource is a good idea, as perhaps remembering these numbers might be difficult. Here is a little test. What would you call a temperature of 106 Fahrenheit or 41 degrees Celsius? Yes, that's right. We call that a high temperature. When a person has a fever, it means that the body is fighting off an illness of some kind. One of the symptoms of malaria is fever. But be aware, not every malaria-infected person has a high temperature. And not every person with a high temperature has malaria. When someone is ill, you measure their temperature at least 4 times a day. In that way, you know if they are improving or if they are becoming more ill. Keeping a record of the temperature helps you to know if a treatment is helping or not. As you can see in the image, this patient had a high fever in the morning. They were given some medication and in the evening the temperature went down. In this case, you could reasonably conclude that the right treatment has been given. Writing down vital signs means another person can take over care of a patient, and by looking at the records, they can reasonably know what the patient's progress has been. There are many different types of thermometers, but they all measure the same thing, the temperature. Whatever thermometer you use, make sure you wash your thermometer with alcohol or with cool water and soap. If you use a mercury thermometer, before using it, shake it hard until it reads less than 96.8 Fahrenheit or 36 Celsius. If you use a thermometer with a battery, turn it on and follow the instructions. There are different places on the body where you can measure the temperature. You will get the most accurate temperature when you measure in the anus. However, we recommend that you measure in the armpit or under the tongue. To take a temperature check in the mouth, these are some things to be aware of. First, if the patient has been eating or drinking, you should wait 30 minutes before you do the check. Second, place the thermometer tip under the tongue and close the lips without biting. And then thirdly, keep the thermometer in place, and if it is a battery one, it will beep when ready. Or if you are using a mercury thermometer, wait for 5 minutes before taking it out. And finally, the fourth thing is, remove the thermometer and read the number. Then clean the thermometer with soap and water, or an alcohol wipe, or throw away the protective plastic cover if the thermometer has one. Be aware to never use a mercury thermometer in the mouth of a child. If they chew on it and it breaks, this will cause serious health damage. The mercury in a thermometer is poisonous when it comes in contact with us. As long as the thermometer is intact, you can use it safely. You can also use a mercury or digital thermometer to check a person's temperature by measuring in their armpit. First, place the thermometer under the armpit, ensuring it touches the skin, not clothing. Be sure to wedge the thermometer tightly in place by lowering the arm over the thermometer and wait until you hear the thermometer beep indicating it's done. Or if you are using a mercury thermometer, wait for 5 minutes. When done, remove the thermometer and read the number. Make sure you clean the thermometer as soon as you finish using it. When measuring the temperature of small children, it is normal to take the temperature from the anus. This method is safe and will give you the most accurate temperature. The first thing to do is put some lubricant like petroleum jelly on the tip of the thermometer and carefully slide the tip of the thermometer about 1.5 centimeter or half an inch into the anus. Leave it there for 3 minutes. After rating, remove the thermometer slowly and then read the number. When you are finished, go ahead and clean the thermometer with soap and cool water, or an alcohol wipe. There is a simple way to find out if someone has a fever when a thermometer is not available. Place the inside of your own wrist on your own forehead. Then, with the back of your other hand, feel the forehead of the other person. Is the other person warmer than you? Just a little or a lot? In this way, you use your own body temperature as a gauge and will know whether or not a person has a fever. This is not an accurate method, but will serve as a rough guide. When someone has a high temperature, you can help lower it with paracetamol. Always make sure you give paracetamol according to the instructions, because giving the wrong amount of paracetamol can be very dangerous. When a person has a temperature, and it is higher than 104 degrees Fahrenheit or 40 degrees Celsius, it must be lowered at once. This can be done as follows. By putting the person in a cool place, removing unnecessary clothing, don't wrap them up in the blanket because then the warmth cannot leave the body. And also fan the person so that their skin is cooling in the breeze. Give them paracetamol to help bring the fever down. In the manual, you can read what you can do if the person can't swallow the tablets. A person with a fever also needs to drink a lot. So give them some juice or water, not caffeine drinks like coffee. If a person is dehydrated and does not pass much urine, or less than normal, or if the urine is dark, give oral rehydration solution. We call this also ORS. ORS is a way to help the body regain sugars and salts that have been lost. You can easily make this yourself. Take 1 liter of clean water plus 6 level teaspoons of sugar plus half a level teaspoon of salt and mix them together. The teaspoon is the smallest spoon and it holds 5 ml of fluid. The patient should then consistently take small sips of the solution to rehydrate. There is more about ORS in the manual appendix. Finding the source of a high temperature and treating the illness is very important. Ultimately, it is important that more medical help is given when a high fever does not go down. Taking a person's temperature helps with this diagnosis. Next, we will look at the heart rate or pulse. This is the second vital sign that you can measure. The heart is a big muscle that pumps blood through the body. Feeling the pulse is a way of measuring the speed at which the heart is working. When a person is ill, the heart rate will be different than when that person is healthy. This is how it is when someone has malaria and is experiencing symptoms. The heart has to work harder to try and push enough blood around the body. The blood moves carrying the oxygen that our body needs, and it also transports waste. We have discussed this in other places in the series, so I won't go into more detail here. You can feel your own heartbeat when you put your 2 or 3 fingers on the inside of your wrist. Can you feel it? Now, jump up and down 5 times and bend down and touch your toes 8 times. Okay, pause and come back when you're done. Whew. Okay, now feel your pulse again. Can you feel your heart beating faster? Now practice and try to feel the pulse of someone else in the same place where you could feel your own heartbeat. Make sure you do this with your fingers and not with your thumb. As if you use your thumb, you will be mistaken and count your own heartbeat and not of the person whose wrist you are holding. If you have a hard time feeling a heartbeat, have a look at your manual, where we describe step by step how to do it. If you want to know if the heart is beating fast or slow, you need first to know what is normal for a person when they are resting. When you feel the heartbeat, you count for 1 minute how many beats the heart makes. For this, you need a clock or a watch with the second hand. You can also use the clock on your phone, as long as you can see the seconds. 1 minute has 60 seconds, so for 60 seconds you count the heartbeat. If you count for longer or shorter, you won't have an accurate heart rate and could make the wrong conclusions. In this overview, you can see what a normal heartbeat is per minute for an infant, a child, and an adult. When you are counting the heart rate, also be sure to pay attention to the strength and the regularity of the pulse. When you are checking someone's vital signs, count how many beats you feel in 1 minute and write it down in the same place you recorded the temperature. Writing down the vital sign measurements is helpful so that you or others caring for the patient can monitor progress over the day. The next vital sign we can measure is the breathing rate. Like the heart rate, the breathing rate is also influenced by many factors. When a person runs, sleeps, or has stress, it will affect their breathing rate. When a person is ill, the breathing rate can be affected by the illness. So, just like the other vital signs, it is important to check the breathing rate regularly. We also measure the breathing rate for 1 minute. Watch the chest. Breathing in and out, we count as 1 breath. Count how many breaths a person takes in 1 minute and write it down with the temperature and the heart rate. Now, when you count the breaths, it is best not to tell the person. Often when you tell them, they start to breathe differently and it will affect your counting. What you could do is when you have counted the heart rate, you keep on holding their wrist and then count their breathing rate. When you are counting someone's breathing, you also look for other things like, does the person have a deep or shallow breathing pattern? Is the person having difficulty breathing? Do both sides of the chest move equally? When the person has shallow breathing or difficulty breathing, or when the chest is not moving equally, these are signs that a doctor is required. In this overview, you can see what the normal breathing rate for people at rest is. For adults, 12 to 20 breaths per minute. For 5 to 12 years old, 16 to 30 breaths per minute. For 3 to 5 years old, 22 to 34 breaths per minute. For 1 until 3 years old, 24 to 40 breaths per minute. And for 0s to 1 year old, 30 to 60 breaths per minute. As you can see in the table, when a child of 60 months is breathing 32 times per minute, it would be normal. But if an adult is breathing 32 times per minute, then that would tell you that there is a problem. The last vital sign is blood pressure. When blood pressure is measured, you are actually measuring how much pressure the blood is exerting against the artery walls when the heart beats. In this course, we won't be able to teach you how to do this, as it needs special equipment and practice. To interpret someone's blood pressure correctly is a complicated skill, and for recognizing and treating malaria, you don't really need to know how to do this. Well, I hope you have enjoyed this quick overview of vital signs. Find a friend and practice with them so that it becomes easy for you to do. Measuring vital signs will quickly become an important tool that you use when assisting people who are suffering from malaria or other illnesses in general. Bye for now!